and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And we'll go on to the roll call.
Dr. Dave Bardo.
Here.
Dr. Noel Deep.
Here.
Wayne Gagnon.
Here.
Jill Maddock Nelson. Andy Mary.
Here.
Mary Neufeld.
Here.
Danny Pyatt.
Here.
Hi, Danny.
Katie Schrader.
How are you?
Good, how are you?
Angel Zimmerman.
The weather stays like this.
Okay, and then I'd like to welcome Wayne Gagnon to the school board.
Thank you. Before we begin, could you make sure you're speaking into the microphone? My hearing aids don't always work. Next week I'll have that adjusted, so thanks, and I apologize. That's what happens when you hit middle age.
Okay. And then we'll go on with public comment.
Mr. President, I want to ask a question. I'm sorry for not getting here earlier to ask you. Can I read an email that was sent to me, to all of us? This email was from Adam and Tara Nicholson.
Oh, I read it.
All those emails are seen by the entire board.
Exactly. I'd just like for the community also to hear some of these emails, and maybe in the future, we could ask these people if they can be printed and published for everybody to see. You know, some people can't be here for the meeting for whatever reason. I don't know. I couldn't find a policy where we cannot read emails.
I recall reading something in policy. I'll try to find it.
Help me with that.
So we'll see if that's in policy and we'll get back to
Okay.
that. We have 3 people signed up tonight, and the first person is Jen Matichowski. And please speak clearly right into the mic and state your name and what you're speaking on.
My name is Jen Matichowski.
I can hear you, but I don't think you're on the mic.
It's on. Hello? Okay. My name is Jen Matichowski, and I'm speaking on specifically the masking recommendation that the school board has in place. My professional background is I am the infection preventionist nurse at Aspirus Langley Hospital. I've been a nurse now for 14 years. Most of my career has been in Green Bay in critical care. I moved back to my hometown of Antigo about 7 years ago and have been in this profession for 3 years. Previously, I worked in ER and oncology before I was in my infection prevention role here in town. And what I wanted to talk about was having the board consider requiring masking in school while we have high levels of COVID-19 activity in Langley County and surrounding communities. Currently, Langley County is at critically high levels of COVID-19. According to the Wisconsin DHS dashboard, which was updated last Wednesday, it's updated every Wednesday, Wednesday evening, Langley County is at 996 for burden of disease, the COVID burden of disease, and at a very critical level with a trajectory that is increasing 63%. Additionally, 8 other counties in Wisconsin have hit critically high levels of COVID-19. This includes Forest and Econo, which share our Langley borders. With this increase in COVID-19 activity, our healthcare facilities are in a state of crisis. With increased activity, we're seeing increased hospitalizations of COVID-19 patients, increased ER visits, increased walk-in visits, and it's also stretching our testing capacity. Today, we have a full ER, we have a full hospital. For the past couple weeks, what we're seeing is that if people need higher level of critical care, they're being boarded in our ER because there aren't ICU beds in the state. Today, we had a very critical ill person, and luckily, they were able to get the one ICU bed available in our state. According to the statistics on the dashboard about our HERC region and hospital capacity, the North Central HERC region, which is laying laid in some of the north central counties, we're at 96.1% for ICU capacity. For overall hospital capacity in our region, we are at 91%. Not all of these patients are COVID patients. These are patients that come in for routine things or infections or conditions. But the increase in COVID-19 activity is pressuring our healthcare system. Things that are different from last year are, last year when school was in session, many school districts had mandated masking requirements amongst other COVID-19 protocols. Additionally, or had variations of in-person and online learning. I've never seen the increase in community activity that I saw last year with these precautions in place. There's been a lot of evidence that supports masking, and I know that a lot of people are skeptical about this research. Recently, there's 3 different studies that were released by CDC this past week that looked at school districts that were in session in July. One of these was in Arizona. And they looked at school districts that implemented masking requirements to those that didn't, and found that school districts that had masking requirements in place were 3.5 times less likely to have school outbreaks. Additionally, another report found that 2 weeks after starting school, pediatric COVID-19 case rates was lower in counties with school mask requirements at 16.32 per 100,000 per day compared to counties without school mask requirements at 34.85 cases per 1,000 a day. And this impacts how universal masking impacts our community. It impacts our healthcare. Healthcare workers are at a point of crisis because they're boarding patients in our ED for up to 2 days. We have ongoing other conditions coming in, traumas, patients that need, we're having chest pain patients come in that need intervention. We have stroke patients that are coming in, and there's no bed availability. This isn't just COVID. This is a healthcare crisis. And our choice to implement a masking requirement instead of a recommendation is important for the health of our community. We're starting to see cases in our long-term care facilities. We haven't had cases in our long-term care facilities in our county since December. This is the first time that we've had cases in our dialysis clinic. These are all people that have done everything right that are now being impacted by some of the decisions we make locally. My request is that we move from recommend to require masking until we get to lower levels of community transmission. Right now, we are at very high levels of COVID activity. I would like to recommend or have the board consider requiring masking for a period of time and reconsidering it when we get to lower levels. For the health of our community, for the safety of our children, our teachers, and I guess if you compare last year to this year, when we had COVID-19 protocols in place, it seems like there was a lot less disruption with quarantine, with school activities missed or sporting events. And that can be disruptive to children's learning. My husband is a second grade school teacher at All Saints Catholic School. And it is very disruptive to the classroom environment when you have students on quarantine. Providing the information to continue so that they can learn on quarantine if they're healthy enough to do their schoolwork at home. And additionally, just the strain on the classroom environment, continuing that forward progress forward in that classroom. So I ask that the board reconsiders moving from recommended to required for a period of time. Thank you.
Okay, thank you for your comments.
Should I turn this off?
You can leave it on.
And next up is Angie Schreiber.
Hello, everyone. So I guess I wanted to ask a question.
Angie, I'm just going to interrupt for a second. I think you got to be closer to that mic.
Okay, is this better?
Yes.
Okay. So I want to, I guess, pose a question, and then I'll give some information regarding it. On August 24th at the last school board meeting, there was a motion made by Jill and seconded by Dave, and the motion went as such. The Langley County Health Department will conduct all contact tracing and will also implement all quarantines. The school nurse will make the Langley County Health Department aware if the school nurse is notified of a positive COVID-19 case and will assist with contact tracing. The Antigo School District neither promotes nor discourages any kind of injection to fight COVID-19. Does that sound correct?
Yes.
Okay. So that was on August 24th. On August 30th, there was a new memorandum of understanding between the school district of Antigo and the Langley County Health Department that was signed by John Zinkowicz, sorry if I massacred that name, Gene Weston, Langley County Health Officer, who has since moved on to a different position in a different county, and Dr. Julie Sprague, and Darlene Jansen, our school nurse. And the memorandum of understanding says the opposite of the August 24th motion that was passed by the school board. So I'm wondering how that's possible. So that's the question. When I called the health department, I asked what the process was that they work on if there's a positive case. My answer that I got was they are notified online of a positive case. Then they notify the family. If it's a student within the school district, they notify Darlene. If it's a school-age person, the health department then gives quarantine guidelines to the positive case family. They rely on Darlene to determine who the close contacts are in the school. The health department was never told that Darlene was not supposed to be quarantining or contact tracing. So they were not aware of this, which is interesting because the board passed that motion on August 24th. But nobody told them that prior to August 30th when they signed the new memorandum. Don't you find that interesting? I do. So what also is interesting is that Darlene is trained in contact tracing and works as an agent of the public health department. Health department has 4 to 5 full-time contact tracers. They keep a list of all the positive cases, and they keep a list of who they call as contact, to quarantine, as in who's been in close contact to positive cases. They keep track of that because that's their regulations, that those are potential positives. Darlene has never sent a list of who she has quarantined. The students that are possible positives, right, that she has sent home that has missed school, and there has been a substantial amount of students that she has done this to, she has not notified our public health department of that, even though she works as an agent of them, right? So I think that's a little bit of an issue. So there's no oversight of this process whatsoever. Not only there's no oversight, but it shouldn't even be happening. She does not have the authority to do that. DPI has said that. The board has said that. You guys voted her not to be doing this. Okay? Our county has hired 4 to 5 people to be doing this. They have the capacity to be doing this. Yes, we have increased county numbers, yes. We have about, 20 or so people in, student staff in our district. I think we can handle that, okay? Another thing that's interesting is, thank you, Dr. Sprague, for sending me the letter that goes out to the families from the school. The letter that gets sent out from our school district is interesting because it's sent with the Langley County Health Department's letterhead. So we are sending out the county's health department letterhead with whatever, it's a generic letter, and then Dr. Sprague or the school nurse fills in whatever school, and then whatever's principal's name is filled in, and then Jean Weston's name is on the bottom, who, by the way, is no longer with the county. So if I was Jean Weston, I would have a little bit of an issue with that. So, I mean, there's so many problems with this, and not only that, there's so much inconsistency, and you wonder why the parents are upset. They're more than upset. They're literally like pissed off at you guys, at the school. Because it's this, this parent's getting this letter, which is different than this letter, which is different than this letter. I mean, my daughter took some vitamins on an empty stomach and had a stomachache, was handed this as she's like walking out the door. And like, I mean, what does this even mean? She came back to school the next day because, I knew it was because she took the vitamins without eating anything before I gave her to school. She was perfectly fine. It was because she ate the vitamins without eating anything. So I would like some answers. I know that you're not, in the policies it says you're not supposed to interact with people that are speaking, but I honestly, and I'm sure the people, the parents that are here, the parents that are watching, we want some answers to this. We want them tonight. So can you please address this? I know, Dr. Sprague, you've sent me quite a few, some emails back and forth that people have been calling because I posted on Facebook, please call and ask some questions. So I know you're aware of this. So can you please address this? And other board members that are aware of this, can you please give us some answers? Thank you.
Okay, thank you. And next up is Rod Zupan. Okay. Thank you. In just to answer Angie, and I'm sure you're aware of this, but we don't respond directly when people are speaking, but we are taking that in consideration. And if you are speaking on a topic that's on the agenda, which you are, we'll talk about it at that time. Okay, we will continue with welcoming our student representatives. And we have Meredith Meidel with us, and Tori Spencer is not here? No, she's not. Okay, and so if you'd go, we all just want to welcome you to being on a representative to the board. I know it's a little process to get on here, and so we're happy you're here.
Thank you. I'm happy to be here.
And could you pull that mic a little bit closer?
Thank
Don't think it's on.
Might have to turn it on, Meredith.
you. Okay. Thank you. I'm very happy to be here as well.
You can go ahead with your student report.
Okay. This week is homecoming week. The dress-up days are Move It Monday, 80s workout clothes, Trendy Tuesday, 80s trends, Like Whatever Wednesday, 80s arcade characters, Totally Awesome Thursday, class colors, Funky Friday, Maroon Day. The homecoming parade is on Friday, October 1st, starting at 4 p.m. and will go from 5th Avenue to Schofield Stadium. The homecoming game is on Friday, October 1st at Schofield Stadium, starting at 7 p.m. They will be playing against Medford. The homecoming dance is on Saturday, October 2nd from 7:30 to 10:30 p.m. There will be 2 assemblies this week, one on 9/28, which was the staff versus seniors in a volleyball game that was live streamed for the non-seniors. And the other one is on 10/1, which is for the student and staff dances and the crowning of the homecoming king and queen at Listle Field. The girls' tennis team had their conference meet in town this weekend. There was a varsity football game on 9/24. That was also the bell game. We didn't win, but they did put up a good fight. The volleyball team has had many tournaments this year. They also are playing tonight against Northland Pines. The boys' soccer team won their home tournament 11-4. They play tonight against Northern Lutheran. They also play Thursday against Mosinee. We had a fire drill a few weeks ago, and it went really well considering that it was our first fire drill since the spring of 2020. We had a tornado drill last week, and that also went very well. There are 18 active COVID cases among the students in the high school as of 9/28/21. There are 2 active COVID cases among the staff in the high school as of 9/28/21. There was a trip to the school forest on 9/23 where students had a lot of fun participating in the activities that were planned for the day. The art club has been working the concession stand at the football games and have been cleaning up after the football games are over. There is a high school choir concert on 10/18 in the Volm Theater starting at 7 p.m. The choirs performing are treble choir, men's choir, a cappella choir, and canto voice. The high school club fair was held on 9/22, and students had the opportunity to learn about different clubs and join the ones that they were interested in. The Elks Club held their Indigo Pride spaghetti dinner on 9/20. Thank you.
Thank you. Any questions from the board for Meredith? Okay. We will go on to the consent agenda.
I move the board approve the consent agenda, including the minutes from the August 24, 2021 Board of Education meeting, September 21, 2021 special meeting, expulsion hearing, and September 21, 2021 special meeting workshop review, financial reports for August 2021, consideration of current bills, checks number 5024 through 5124 in the amount of $326,738.03, ACH number 212-200122 through 212-200225, in the amount of $597,599.95, and one wire transfer in the amount of $21,092.92, for a total of $945,430.90.
Second.
Okay, any questions or comments on the consent agenda?
I will vote yes on the consent agenda, but I have to abstain on check number 5086.
Okay. Any other questions or comments?
Yeah, Mr. Mayor, on the minutes from the last month's meeting, this is probably maybe a typo from Mary Kay. The consideration to approve district property naming, I did vote in the negative on that, and it has me voting in the affirmative.
Okay, I'll make that change.
Thank you.
Okay. Anything else? Then we'll go ahead with a roll call for that, Mary Kay.
Bardo,
Yes.
Deep,
Yes.
Gagnon,
Yes.
Maddox Nelson,
Yes.
Newfeld,
Yes.
Hyatt,
Yes.
Schrader,
Yes.
and Mary.
Yes. Okay, we're going to go on to COVID update and possible action. And
There are two motions this evening. The first is related to the ABC Science Collaborative Research. This is, it was brought to our attention from WASDA, which is the organization district administrators belong to, but it's a joint effort from UW-Madison and Duke University. What struck me about it and prompted me to bring it before you for possible approval is I know the board has a desire for more COVID data than we as a district can produce. So it's free. The assurance is that it won't be taxing on employees. And since it's a voluntary basis, I, would ensure that we can withdraw if it became overwhelming. But I do think it would be interesting for the board. It talks about looking at our trend data and, comparing it. And those are things that we simply are not equipped to do as district employees. So I thought it would be worthwhile.
She said she's signed up to
Speaker?
speak on this as well. Was her name on their choice?
yes. Okay, I overlooked that when you were speaking before, but I'll allow you to come up and speak.
Oh, that's Angie.
Thank you for allowing me to speak on this. Let me ask, how many of you know about the ABC Collaborative Project? Can I see a show of hands?
Well, from what I've read.
So you've read a little bit about it, Mary? Okay, so obviously Dr. Sprague knows a little bit about it, right, Dr. Sprague? Okay, so nobody else knows about it, but yeah, we want to vote on it tonight, if we should join it or not?
I know about it.
Oh, okay, so you,
It's, it's up to the board. They don't have to raise their hand because you asked.
well, right, but why wouldn't you? If you knew about
It's
it,
up to
right?
them.
To let the public know.
Okay,
Okay, so if you don't raise your hand, then we're gonna all assume that you don't know anything about this, but yet you're gonna vote on it. That makes a lot of sense. So I did a little bit of research on this, and the ABC Science Collaborative, what they do is they do sampling of schools, and like you said, they follow what the schools do for COVID mitigation. And on the front, it sounds like not a bad idea, right? But further investigation, what they do is they really promote masks wearing with promoting vaccine promotion. And it doesn't matter when it comes down to quarantining, it isn't going to matter. If you wear a mask or not, you're still going to be quarantined. Unless you're vaccinated, then it's the God's, will, everybody needs to be vaccinated or given the shot. In fact, they go so far as to say that you should be double masked, according to their website, double masked. That's what they say. But the thing is that their questions are actually biased. I'm looking for their questions. Where is it? And I know you're keeping, the time is ticking. I know that, Andy. So they ask, are masks required indoors? Was your district following their quarantine policy? What's your policy for lunch? Here's a good one. Does your district require the COVID-19 vaccination for eligible students as a condition of in-person learning? So does that mean that they're going to, next year, say, oh, you need to have the vaccine before you can come to school? Because that's what's going to happen. That would be the next thing that they're trying to push. Does your district require COVID vaccination for staff as a condition of employment? So guess what, teachers, that's what's coming. How many of your new student secondary infections were related to sports, related to lunch? How many of your student quarantines were related to sports? How many were related to lunch? So, on the surface, this looks like it would be so innocent, but when you really think about it, where is this going? How many students were absent at least one full day for any reason? How many staff were absent for any reason in the past month? Have you changed any of your policies in the past month? One thing that you need to understand is that their reports are biased because this is not, the school districts that participate in this study, this is not a random sampling, okay? They're voluntary so that they can pick and choose. So these schools can have, different health protocols in place than other schools that are not participating in this study, and so they can be more rigorous in their COVID mitigation because if based on how their policies are versus this other school district, and if they're working with a collaborative, so maybe they want to make a point in things, so they're going to be biased in how they're representing things. And yet, there's so many things that are, so many organizations and school districts that are taking the results of what this study is using as what we all should be doing. And I don't think that's right. And so I ask, as a mother of a student, as a taxpayer, and as a community member, that you vote no to participating in this study. I don't think it's right. And I think it needs to be vented more, and I think you need to look at the bigger picture of this and do further investigation. Thank you.
Okay. So I think before we go any further with this discussion, we would need a motion. Nobody wants to make a motion on this?
I move the board approve the district participating in the COVID-related research program titled the ABC Science Collaborative with the report back at quarterly intervals.
I'll second.
Okay, now we could have further discussion.
Mr. Mayor, I also will vote negative, that we don't need to participate in this because of some of the research that has been pointed out to us, as well as while she was speaking, I was on their website looking at some of the other research, and I do not feel comfortable that our school should be a part of this.
Patrick, did you want to speak on this, or Danny? So if we're reporting what we're doing, what does it hurt? They can't require us to do anything. They're just trying to figure out what works. It's like a big data approach to,
It may not hurt anything today, but what is it going to do tomorrow? We don't
yes,
know.
tell me. They cannot require us to do
So I
something.
do not feel comfortable participating in this. We need to keep our data right here in our school and use what Julie gives to us from our administration and use that as our data.
Okay, so you're happy with the data we get from Julie? It seems like you ask a lot or more.
As I'm asking, as I need questions, Julie has always been right there to answer my questions.
Okay, so you're okay with the data we get?
Absolutely.
What about Jill? Are you okay with the data we get, or you want to do this?
I don't think Jill was asking the question. Why are you asking her that?
I just wanted to know her opinion.
So-
If she wants to give it, she will.
My feedback on this is I did reach out to Dr. Sprague to ask further questions.
Excuse me, could you please speak in your microphone? My hearing is terrible, and I apologize.
Yes, sorry. Every time I move, the mic goes off, and I feel it's really distractive, so I'm trying to find that balance. I apologize. My feedback is I did reach out to Dr. Sprague for some more information because I felt the information provided in the attachment was not very informative. One big thing that stood out to me was the PDF stated, quote, minimally burdensome for staff, and I, coming in without any further information, did not feel comfortable supporting this because I don't know enough about the study, so that makes me feel very uncomfortable, and I feel like if I don't have answers to questions I asked Dr. Sprague, those would be very similar questions parents would likely have. When I go to minimally burdensome, if Ms. Schreiber is correct, and I don't have reason to believe she's not, it sounds like that's actually more intensive data collection than what we're currently doing, and it seems as though our staff are already quite overwhelmed with contact tracing and quarantine contacts in general, not quarantine, COVID contacts in general, that I don't know that it's feasible for our staff to include additional data that's not already being collected. It'd be different if we're collecting it currently and would just implement or input that data somewhere, but we would, the way I understand it, would now have to do much more with our data collection.
I made an assumption that the data they are looking for is what we'd already be collecting, but, you know, without having been through the process, that assumption might not be absolutely true. I did check with Darlene Jansen too, because she's, as you all know, foremost in collecting data on positives and those in quarantine, because I would not add to her plate without her agreement. And we just felt the value, if we can have more data to look at and that helps us in any way, shape, or form, I thought it would be worthwhile.
I'd like to, first off, again, I'm going to apologize for my hearing. With the acoustics, I couldn't understand what you said. My opinion on this, the more data we get, the better off we're going to be. They're going to collect data from school districts all over Wisconsin. We'll be able to see what they're doing, how well it works compared to what we're doing, and how well it works, and then we can make adjustments as we need to. If we're doing something a little differently and it's not quite working, and somebody has something in place that is working, we should have access to that data.
You cut out for a second. I didn't know if you got too far away. Pardon? You cut out for a second.
Yeah.
That's-
I think that, again, I think we should have as much access to as much data as we can and compare what we are doing to other districts. And if we have to make adjustments to improve our situation, we should be able to do it, and this will be another tool that we can use.
Is this data then available to districts that don't participate? If it was presented from the state superintendent, I would take an assumption that data would be shared in superintendent meetings through the state.
The only communication I've had about this is through the email I shared. The notice from, it wasn't the state soup, it was John
Sorry.
Bales from
Thank you.
WASDA. Yep. So that's, so I don't know. Often, studies like this, the results are published for the public. So again, but I'd be making an assumption. I have not read that.
So I'll just share some of the questions I have because I do anticipate that parents would have similar questions that were asked, but we don't have answers to. The requirement of the district, how long the study is anticipated to occur, what do they define as, quote, COVID-related research, and then do we reasonably have the staff resources to provide data collection given excessive staff efforts with contact tracing and follow-ups? So those would be important questions that I feel would be valuable for me to vote in favor.
Julie, would it be
Okay.
possible to see if you could get some of the answers to some of these questions, and we could like table this till the next meeting?
I'd just like to speak to the nature of providing data for a collaborative. This is part of a standard of education that has existed for greater than 50 years, in which schools and other places generate information and data. You have researchers, doctors, scientists, individuals at universities that make requests for that data and information in order to help educate and to expand our knowledge of things. This can be things from teen suicide to drug use in schools. In fact, we collect extensive data on this and is provided to the government on a regular basis to inform us. And this is really in that vein. The organizations we're talking about, the national partners are the University of Wisconsin School of Medicine and Public Health, Duke University School of Medicine, Case Western University of Metro Health, Harvard Medical School, University of Utah Health. And so this is just a standard, normal thing that has existed for a long time. They're applying their research and expertise to a problem that we face right now, and we should welcome that. And certainly you can table this for further discussion, but this is well within the norms of education, science. These are institutions that have extensive controls when it comes to studies, when they're looking at data and information, protecting private information, all of that. So, I would highly recommend moving forward with this. And it's just a reasonable small step. It's nothing earth-shattering. And if it's too onerous, we can back out of it. Essentially, it's a collaborative, and we'd be participating in that by giving our data. Eventually, that data will inform decision-making throughout the country. Seems very reasonable.
Dr. Deep, you think we should do it?
Yes, and again, the reason I made the motion is that we need to discuss it. And people can make a motion, people can second it, whether they agree with it or not. The intention is that we need to discuss it in the open rather than just pushing it back. Whatever we have come so far, as Dr. McKenna alluded to, changes that have happened are based on the scientific data that people have collected over the years. When we have addressed health issues, that's how we come to a decision if certain medications are working or if certain things are good or not so good in using for treatment of patients, or how you diagnose something, or all of these diagnostic and therapeutics, that's how they're developed. What they're asking for, this is a bunch of universities who are looking to collect data. They're going to analyze it. We are not going to get penalized for it. And that information is not going to be used right now against you. It is going to be used in the future probably to educate or to inform somebody who might then be able to make an informed decision saying that when this happened, this is what the data collected showed a year ago, 2 years ago, 5 years ago. So somewhere in the future, it might benefit somebody. We are not going to continue with it if it is going to be an undue strain on our resources. It does not hurt to at least check with them to find out the details and what are our obligations. And whatever the results are, it is not going to obligate us to follow any recommendations from them. They are not going to give you certain recommendations. They are going to come back to us and tell us that, this is the data that we collected from your school district. We as a board can look at it. If you don't want it, you put it in the trash. Somebody is doing the data collection interpretation for us. That's all it is.
The data collection requires this district staff to be able to do that. And so, Dr. Sprague, when a board member requested numbers in 3 different areas, we didn't have that data readily available, correct? We had to pull that data, correct?
From last year, you mean?
Nope, from the 2-week time frame.
Oh, yes.
So that's where my concern, the practicality of, is this feasible and reasonable to add this to our staff expectations? And I do feel that right now they're already overloaded, and I don't know that we have the capacity to do that. So I would defer back to you, Dr. Sprague, on that, and the capacity for our staff to add, without knowing specific data points they want collected. Can we do that? Or is that just more burden on them? The county can hire 4 to 5 contact tracers. We're not going to hire data collectors for this specifically. So those would be the logistical components of this. I'm not opposed to data collection at all. Absolutely, I'm always requesting data. I just am more concerned about the practicality and how that plays out for our staff.
And again, having checked with Darlene, we feel that we could put this into the regular scope of what she's already doing. If we would find out that it is too burdensome, since it's voluntary, we did discuss too that we could, bow out, so.
And you would notify the board, of course, if you did bow out.
Of course.
Would the board favor probably getting more information before you sign on?
So the first part of this was for me to fill out a survey with just the logistics, name of district, et cetera, student enrollment. And I think that's when the additional information would come to me. So Danny just shared too that the survey itself would not be available anytime soon. So I'm not sure that I would have all of the definitive information in the future if the board wanted to table this. I don't know that I would have any more than.
But you'd have to sign on to get that information from them, what it entails.
Right. I could bring that back, of course.
I'm just curious where Ms. Schreiber got that additional information. Maybe we could utilize, I don't know if that came from the website or not, but those data collection questions were intriguing to me, that maybe there's information from the website, so maybe we can just do some further research on their own website.
And those are the questions that we have the data on already, the ones that she referenced. Like, are we mask mandated? How many positives, the attendance? We have that data.
Any other comments from the board? Then go ahead with the roll call vote.
Deep,
Yes.
Gagnon,
Yes.
Maddock Nelson,
No,
Newfeld,
Yes.
Hyatt,
No.
Schrader,
Yes.
Bartle,
No.
Mary,
Yes. The next item is consideration to approve COVID vaccination clinics in district schools. If somebody'd like to make a motion.
So we've not had this before the board. Oh, I'm sorry. Go ahead.
If somebody'd like to make that motion.
I move the board allows Langley County Public Health to hold COVID vaccination clinics in our schools. While we would jointly advertise the logistics of each clinic, the district will neither encourage or discourage families from taking part.
Is there a second?
I'll second.
Okay, so this has not been before the board for a vote before. I just wanted to point out, we do have a facilities usage policy, 7510. And we have done this for years, as we pointed out last meeting, with a flu clinic. And the language in the policy already prohibits anyone, so let's say the health department, for example, to convey the impression that the district supports or endorses the cause. In other words, we really cannot discriminate who uses or fills out the paperwork for our facility. So because we equate this, I equate this with the same as a flu clinic, we should offer that same opportunity, again, without the endorsement or steering our families there. One other item that I would say is the policy. It was good for me to go back and reread. Does say that the board will permit if I give prior approval. So I just wanted to bring that to your attention tonight as well, which is why it's on the agenda as a vote.
Okay, any
So will this be part of the regular immunization clinics for flu, the influenza clinics that they have, or are these going to be separate?
I'm sorry, I couldn't.
Are these clinics that you're referring to, the immunization clinics that we are talking about here, are these at the same time that we are offering the influenza or the flu vaccines?
That is a great question, Dr. Deep. We have not discussed this at all because I wanted the board's vote first. But that is something we could offer if that's what the health department thought would make sense.
Julie, when would the health department utilize our facilities, obviously after school hours, or certain days, or, and that they're making this request?
Well, yes, they did, as you recall, quite a while ago, back when we had open houses. To be honest, we have not revisited. I haven't revisited that since with them. Other districts who are hosting these immunization clinics talk about, you know, the logistic advertising, the time, place, the necessary forms. I know there was a concern. Of course, we would have consent. We'd have all of that ironed out.
I see in the paper today that Pfizer submitted that their vaccine is effective in children ages 5 to 11, and that they could potentially get a result on that to approve it around Thanksgiving, but there's not sure on a timetable, so that would be certainly something that should be on the back of our minds, that it might keep a lot more kids in school. I get one other question before, I'm sure Patrick will talk about that. Are we going to be able to talk about the quarantine thing here next after we vote on this under a general COVID heading, even though we don't have, okay.
Yes, I have data to share on that too.
And this is open to the public, correct? Anybody can come?
Correct.
Okay.
It's part of the standard of public health over the past 40 years to allow this. The vaccines are authorized, they are effective, it's a reasonable thing to do. And again, people have free choice in this, so people can choose to get them or not get them. And just as Dr. Sprague noted, there can't be coercion one way or the other in that regard for the events themselves.
Has the Langley County Health Department identified any barriers to people having access to the COVID vaccine? That by hosting clinics, it would increase access in some capacity?
Jill, it's part of the standard of public health to try to provide multiple different avenues for vaccination. When I talk to patients in the clinic, often they're quite busy. Sometimes they can't get their children in, or they have difficulty, making an appointment, and that's when they would often get their vaccines. So we have a long history of offering vaccination clinics in the school districts that are a convenience and a service to our parents, and they do utilize it. If no one utilized them, public health has limited resources, and they would have likely moved on to other avenues. So the evidence bears itself out over time. Does that answer that?
No, I was wondering about access, like if that's been an identified barrier resulting in this.
Oh, I mean,
Like
it's access in terms of getting the vaccine?
yes, I believe the health department received funding to increase or to remove or help fight barriers, transportation barriers to those wanting the COVID vaccine. So I know that our parents have expressed a lot of concern with the blurred lines between education and medical with COVID, and this vaccine is not approved for all children in our district, and parents would like to see longer-term data on the vaccine. So I think that would be a concern for parents of the district hosting a vaccine clinic specific to the COVID shot.
I believe it is fully approved for 12 and older, so I think only those for whom it is fully approved, those are the ones who would be able to get it. It would not be given to a 5-year-old or an 8-year-old or someone like that. And even in that age group that we are talking about, the 12 to 17, you are still looking at parental permission for those things. I have utilized the school services for my kids. Otherwise, I'd have to take off. I'd have to take them from school during office hours and get them their flu vaccines. And we'd just sign a form and give it to the kids, and they'd get their flu shots at school throughout their schooling.
Oh, I agree.
Yeah,
With
it's
that,
just an advantage. It saved me an hour or two every year.
No, I think there are definitely benefits
I
to it
appreciate
entirely.
public health for that, yeah.
I think my statements, our feedback is focused on that engagement component with the community and wanting to build that up, and I think this could be a barrier to that.
Well, the way I look at it, Jill, people have made up their minds. If they're not going to get it, they're not going to get it. You're offering it just like you do the flu shots or other vaccines for children to catch up on if they have missed their vaccines. And again, the logistics for the COVID vaccine is a lot different because once you thaw the vial and you do it, either you have to give the shots or that whole vial goes to waste. You have a certain time period during which you'd have to give the vaccine. So for the Pfizer vaccine, once you thaw it out, you have 120 hours. With the Moderna vaccine, it's a few hours. So they'd have to have enough people signed up in advance for them to consider doing those clinics. So there are lots of permutations and combinations there. All we are saying is if public health decides to offer that, depending on their ability to staff those clinics, we are saying it's okay for them to do that, offer their services. This may be a non-starter for all we know.
Okay, any other comments? Mary Kay, we'll do a roll call.
Gagnon,
Yes.
Maddox Nelson,
No?
Newfeld,
Yes.
Hyatt,
No.
Schrader,
Yes.
Bardo,
No.
Deep,
Yes.
and Mary.
Yes. Okay, we'll go on with the rest of the COVID update.
Okay, we have an update, obviously, and for those listening, the COVID dashboard is updated daily, sometimes not until the evening, but it is done daily. So right now, I know that we're watching that percent positivity. It's at 1.29. The high school has the most cases right now with 18, as our Meredith shared. Other than the dashboard, we do have some data comparison. I know that the board has been waiting to hear some of this compared with last year. So with September 28th, and this was just shared today, September 28th being that time marker for last year and this year. Last year, we had 6 positive cases by this September 28th. This year, we're at 105. In fact, all of last year, we had 177 total. Quarantine, which we'll discuss further, students quarantined because of close contacts or being symptomatic. Last year, 205. By September 28th this year, 975. And then there's great interest in those who are quarantined, whether or not they manifest as positives over time. Last year, there was a 2.92 positivity rate, and currently this year, we're at 10.76. Of those who tested positive this year, we're at 90 students. Almost 17% of those are close contacts from school. 25.84% are close contacts from family, and almost 59%, we don't know. We could not determine where the close contact originated. It is very noteworthy and tough for me to share, but we have 2 students who are currently hospitalized. And the research article that was mentioned in public comment, we did upload. Dr. McKenna shared that with me, just talking about the effects of schools, or the difference in schools who began the year with masks and those without mask mandates, and the likelihood of having a COVID outbreak.
Julia, Dr. Sprague, are the 2 hospitalizations, were they school contact? Or are those unknown?
I cannot answer that question, sorry. I don't know.
Okay.
So can you review what it looks like for the contact tracing from the school's perspective, and then from 3 o'clock on, how the health department kind of takes over the contact tracing to identify student to student versus communities?
So our MOU with the health department, and it originated with a motion, was to follow the health department guidelines. They in turn follow CDC and WHS, as you know. So it is true that Darlene is our only district contact tracer, so she's very involved at their request in all school contact tracing. When it is determined then who has to quarantine, again, not because she says so, but because that's what the CDC guidelines indicate, we do get help to make those contacts. Otherwise, she would be working 24 hours a day. So the board is aware we had a mistake. We tried to expedite the process with 7th grade, and that was a letter that we sent because 7th grade is not cohorted this year like they were last. So it is nearly impossible to determine close contacts because they move all throughout the day. Not impossible, it's just nearly impossible. So what we did with the health department's endorsement was send a letter saying it's possible your child had contact. Well, that letter, we used our school messaging system for efficiency, and it turned out that, you know, with the wrong click of a button, we had an email that didn't match the voicemail. We really regret that error. However, Principal Heather McCann fixed it shortly after and clarified the intent of the message. So I just want to reiterate, and I'm sure the board knows, Darlene does not decide in a vacuum who quarantines and who doesn't. That information all comes from the guidelines that we did not establish. We are simply following.
Yeah, and just to echo that, I mean, we have a statutory requirement to follow those guidelines. I mean, the state of Wisconsin requires us to follow public health guidelines in this regard with these sorts of health situations. So we're following statutory guidelines in that regard. I believe you noted, Dr. Sprague, at the previous meeting that there are 2 districts that are not necessarily, I don't know if they've changed, but that 20 of the 22 districts that they discussed that were following guidelines according to their health departments and according to state guidelines.
One of those has revised its protocol, and I was recently at the superintendent convention, and as everyone listening can imagine, this was the hottest topic there. COVID related to legal issues, quarantining, student achievement, attendance, you name it. And took a close look, which I shared with Dr. McKenna at Green Bay's model, because their local health department is saying, okay, if you don't want to quarantine, that's asymptomatic students, that's okay because everyone is masked. It's a mandate there.
And so, Dr. Sprague, just to reiterate, if we were able to work and coordinate with the health department in a context where we say, yes, our students are masked, there's a possibility that the health department might agree to something like that. I don't know if they would or not.
There are districts and health departments across the state
Yeah.
who are doing that, yes.
And I would support that during this time of high transmission and incidents. If the board wished to have us discuss that with the health department in the context of requiring masks during this timeframe when, I mean, as was noted in comments, I mean, the hospital is jam-packed and we are not at the peak of, the illness and the burden of illness that is going to affect us. I think it would be a very reasonable thing, but it would require certainly taking that step, that masking be, instituted during this high transmission time frame.
I have a question for you, Patrick.
Yeah.
Now, when you look at the criteria that you use for quarantine, somebody who's unvaccinated has to be off for that 14 days, come back after seven days of getting the test, and they might return to school. Those who are vaccinated do not have to quarantine. They'd have to come back, but for the next 14 days, have to mask indoors under all circumstances.
Yes, under the guidelines, vaccinated individuals would
Right.
need to mask, but because we don't require that.
But as a medical advisor, I know that right now we are recommending masking. What if the kids wear the masks before they are deemed a close contact? Can we make an exception for them not to be in quarantine and use the same criteria as the vaccinated people?
You mean currently, if students opt to wear a mask and they're close contact, we would need to discuss that with the health department. I think we would want to sit down and get their opinion on that and see if that's acceptable according to the health department standards. Obviously, they're talking with their colleagues in other districts as well.
Because, you hear so much about the students being quarantined, unable to get along with their studies and things like that. Would that be something to consider, and would you be able to at least discuss that option with the health department? Would that, might be a motivation for students to wear their masks if they are going to be not cohorted or anything like that?
That's, Dr. Deep, I think that's a reasonable thing. So, I can certainly, we can talk about that and set a time to meet with the health department.
And then if that happens, if they permit them back with their masks on, as long as they were masked prior to the contact, could we then ask them to be tested at that 3 to 5 day interval instead of the 7 or 8 days?
Absolutely.
That way, their contacts are again, you're decreasing the contact tracing period.
Absolutely.
And lesser time away for the other kids.
I know that it is a challenging subject, but would the board consider instituting a temporary mask requirement for students? Because a lot of students are out, and we are really at a high amount of transmissions in the county. I think, again, I don't desire this forever. And certainly as numbers go down, it's reasonable. But I mean, I think it's really telling looking at our data this year compared with last year. Just the number of cases, the number of in-school transmission. We were much more successful in keeping students in school last year than we are this year. And we could do a better job collectively with them.
And it's a drain on the parents too, that they'd have to take time off, or, in addition to your work, you have to find time to coach your kids and teach them at home.
Exactly.
Help them catch up with stuff.
Dr. McKenna, in that discussion, referencing that landmark study you shared the last time, if you do have a discussion with the health department, I would then assume that masking would be surgical masks based off the findings of that study you shared previously, correct?
That would be the recommendation. But, there are additional studies that suggest even mask wearing, the article I sent you, that masking is effective as well in schools for keeping students in school and reducing transmission. Certainly, I support the surgical masks. I think they're very good, and they are more effective than cloth masks.
Well,
Absolutely.
I think, yes, of course, surgical masks would be much more effective. But, I look back to last year and what we did last year with the kids wearing whatever kind of masks they had. And from what I can tell, and I've spoken to a lot of people and a lot of teachers and a lot of community members also, that it wasn't a kid issue. The masks weren't a kid issue. They would wear the masks. Yeah, maybe some of them didn't want to, maybe the older kids didn't want to, but you know what, they obviously worked. It worked better, and I think that we are seeing a problem here now, and this quarantining, from what I understood with the things that I read yesterday and today, is that we've got secretaries sending somebody home and coaches sending somebody home, and this one has to quarantine, and it's already been 10 days since they were exposed. I don't know if this is, I don't know what to, we're hearing all different kinds of things coming from all different kinds of people. And when I spoke at the August board meeting, before I got all emotional because I was upset, I said, when it comes to the quarantining, it needs to be spelled out in simple layman's terms what the process is. And if somebody is, if I'm exposed to somebody or close contact with somebody, you can't come to me 10 days later and say, oh yeah, you need to be quarantined now. And we've got kids that are not in school, and we've got supposedly the staff is not cooperating, the canvas is not filled in. They're saying the teachers aren't doing their job, and again, the teachers are overwhelmed with how much they have to do. But if these kids are on quarantine, then it's the responsibility of the administrators in their buildings to make sure that they are posting what needs to be done in a timely manner, not at 8 o'clock at night for this assignment for today. If they're organized, they should know at 7:45 in the morning what they're doing that day, hit send or whatever they do. But this is, we're right back to everybody's doing something different and nobody knows what's going on, so everybody bitches. And everybody complains, and we're getting one side here, one side there, and I sit up here and I don't know what to think, because everybody's got their own opinion, and we're supposed to put our personal feelings aside, was one thing I read today. Some board members need to put their personal feelings aside. Well, my personal feelings are the same as the person who wrote the letter's personal feelings. Everybody's got their own personal feelings. I don't have a reason for, I'm not saying, oh my God, everybody should be vaccinated. That's not what I'm saying. If we want to have a vaccination clinic at school, it's like the flu clinic. And kids aren't going to laugh at another kid because they got vaccine or not getting a vaccine. People don't know what it's like inside a building. And when you're there 8 hours a day, 7.5 hours a day with those kids, you're not seeing what I'm hearing that is happening in these schools. That's not what it is. And I don't know, we just can't seem to come to any consensus. Nobody's happy. And so I think we just need to either mask and then no quarantining, or keep running around with this craziness that is called quarantining.
Mary, it is a frustrating, challenging time. We have cases rising quite a bit in our community.
Yes, they are.
And
And I'm really concerned about the fact that we have 2 students that are hospitalized right now.
absolutely.
And I'm guessing they're not hospitalized here, unless they got the beds here. I don't know, but I mean,
don't know.
that's another issue. When it starts affecting the kids, then we have to put aside our personal feelings and do what's best for all the kids and the staff. And I'm not saying they have to be vaccinated. I don't know what I'm saying, but we got 2 in the hospital right now, and God help us if something happens to somebody, especially a child.
Mary, when I spoke in August, I said we are reaching a time in which we're going to have increasing cases, and we're going to have school-based transmission very likely during the next month. Said that we're going to have a lot of children out of school, that this is going to be a profound challenge. I had a recommendation for the board. You chose a different path. Certainly, that is, we are where we are right now, in part because of that, and in part because of the challenges that a pandemic brings to us. So,
I think this all has significant impacts on student achievement, and I don't know that we fully address how our decisions or discussions are related to student achievement in comparison to, it feels like the bulk of the discussion is physical health from COVID. And that's just my perception when we talk. Are we talking about protecting kids from getting COVID, or are we talking about mitigation efforts that are reasonable while focusing on student achievement?
Both.
Well, I think if they're in school, that's going to help student achievement, and how are we going to get them in school? This being at home and trying to go off the computer, and one girl was taking a car class, some kind of engine or something, and she can't do it online. So I don't know, how are we going to improve student achievement? The kids have to be there. The staff has to be there. And that needs to be our focus. But then all of this is affecting that. And the mental health. Yeah, nobody had any answers for the mental health 2 weeks ago or a month ago or whenever it was. We don't know what the impact of the mental health is. But I think I'm about ready to need some mental health relaxation
Absolutely,
skills or
We
something.
don't have enough
Dr.
resources.
Bardo? Dr. Bardo, you.
Dr. Sprague, just a quick question. I wrote down 2.9% for last year, 10.76 for this year. What was that for? Was that the kids, a percentage of kids who have tested positive?
Yes.
Can you give me the number?
Quarantined students.
With symptoms quarantined, or?
No, I want kids who have tested positive for
Since-
COVID, not those who have been quarantined
I believe
or
that's on the
thought to
dashboard.
be. I got the floor now, Dr. McKenna. You're an advisor.
Absolutely.
I'm on the board.
Absolutely. Absolutely, Dr. Bardo.
That was the first data point I shared last year. As of September 28th, we had 6 positive students, and this year, 105.
Okay. Now, I know that Darlene has data that shows us some students are vaccinated, some are not, because that determines the length of the quarantine, correct?
It is a variable considered for quarantining, yes.
Okay. Therefore, we have the data. I don't want to know names, but I want to know of those 105 kids and staff, how many are vaccinated and how many are not. Because we have that data, because that's how the quarantine is based. And that's just for my,
Dave,
I would
that's
like
not
to know
correct,
that number.
actually. Yeah, if you were vaccinated, you do not have to be quarantined if you are asymptomatic. Are you referring to symptomatic students and wondering if
I
you're...
just want to know what the 105 are for.
You mean the 105 who had coronavirus?
Yeah,
And you want to know how many of those individuals were vaccinated?
correct.
Would you like the breakdown of student and staff too? Because I think that's relevant.
I think
the
it is
number
relevant
was,
also.
I think your number
think
was
you're right.
students, correct?
Okay,
Dr.
we can get
Stewart?
that.
Is what?
You shared it was 105 positive students, correct?
Positive cases, students quarantine, Darlene, students and staff, that 105?
The 105 is the combination of staff and
Okay.
students. We had 90 students and 15 staff members. And yes, there are some that were fully vaccinated that did have a breakthrough case. And I am able to get those numbers. I don't have it readily available right now.
Okay,
And I don't expect that you would, Darlene, but I just know you have it.
Yes, I do.
Thank you.
we'll share that.
Okay.
I don't want to say we got lots of emails from parents asking us to get rid of the asymptomatic quarantine, and we sort of tried that last month, and they told us it's up to the health department. We don't have that power. So maybe what Patrick's saying, they can negotiate. Maybe they'll say asymptomatic students who were already wearing a mask won't have to. That's a good idea, Dr. Deep said. You had. And I mean,
I would
maybe that
strongly
would.
support that because you want those students back in school.
Yes.
You know, you are, if all the students wore masks and if you were notified that there was one student among these 30 kids and they were in close contact all day, you don't have to send any one of those 29 other kids home other than the one positive student who's symptomatic and might be home. But the rest of them should be able to return to school like we do now with the vaccinated students and ensure that they keep masking and then test them at 3 to 5 days. Like you do now for the vaccinated people. I don't know if the health department will balk at that, but if we can negotiate that with them, that will give us the opportunity to keep our students in school.
And even if, I mean, that would certainly consider voting for a mask mandate maybe instead, if they said.
I can't guarantee that from that, but.
Right, I
yes,
can't either,
If
but-
that works, if the school board is supportive of that, I would make that motion that we'd get the masks on board for the next 2 months or 1 month or whatever that you want to do until the cases drop.
Right, because it's very, I mean, it's very
It is,
interesting
and
for
as a
everybody.
physician, I can tell you that
Yeah.
it is miserable. If you stand outside, yesterday we had people going outside the emergency room. We were swamped. I have taken care of people who have been in the emergency room for 2 or 3 days waiting for a bed somewhere.
Yes,
That could be my father, that could be my mother. I don't want that happening.
yes.
We are receiving phone calls from Indiana and Illinois and Missouri asking to take patients because they are swamped.
Yeah.
And if, as Mary said, yes, we have 2 kids who are at a different hospital, we don't have beds. We don't have staff to take care of those. And God forbid something happens to our kids, how can you face those parents?
Yep.
We had every chance to protect them and we didn't.
Our local health department currently does not require masks for their employees or visitors of their building. I would just note that. It's only recommended,
Okay. Do you,
which would include like jail staff, law enforcement, health department, social services.
But we're talking about kids.
So we're talking about collaboration with the health department and masking, but the health department themselves do not require masks. So I'm just sharing that feedback in the
Right.
context of,
I mean, if I thought you could talk the health department into not making us close contact quarantine right now without mask, I'd say you should go try to do that, but I don't think that would work.
But if that helps us get rid of the quarantine for our kids, why would I not support the masks? If they will let me keep our kids in school without having to quarantine, even if there's a positive case, as long as they're asymptomatic and they were masked before the exposure and they are masked for that 14 days following, they should be allowed to stay in school. If they allow us to follow that protocol, I'd be in support of the masks.
Yeah. If you look at Green Bay's numbers, I mean, they're much better than ours. And that's the policy that they follow in masking, and then, you know,
So then there are precedents for that.
yeah.
Dr. Deep, so if the statement is true that a student got notified 10 days after their close contact, should they still have had to quarantine, or should that be something that, I mean, they're already past their period, right? Like, how do we clear that up?
If that was me at that stage, I'd have probably tested and said, because anyway, you're tested that 7 days. So if it's 10 days past the exposure, I'd test, and if you get your rapid test back, you can continue to go back to school. Isn't that how we follow it, Darlene?
Well,
Am I
if
wrong?
I can address that. First off, one of the reasons some of the people are getting notified so late is that we have had such an influx of tests that it is not being downloaded and we're not being notified on a timely basis, and public health is not getting the results. Another issue that we're having is that people are keeping their children home and waiting for symptoms, and if the symptoms don't resolve, then they decide to go and have their children tested. So when we get a result, and what I have been practicing, if we get a result where it is at day 8 or day 9, where they would have to go home for 1 day and then come back, I have been sending letters or sending a dialer, and what it says is your child may have been exposed. Please monitor for symptoms. If you find that if you see any symptoms, don't assume it's a cold. Don't assume that it is allergies or flu. Please keep them home and consider getting them tested.
So are you calling that a one-day quarantine, or you're saying if they see those symptoms, keep them home?
If they get, well, that's when I would start the symptomatic quarantine. If they see, I don't make them stay home if it's day 8, 9, or 10.
Okay, so that's clear in the letter, that they are not required to stay
Yes,
home.
it
if
says
don't
they
have
may have, they can continue with their normal activities, but please do this. I do not require them to stay home.
Okay, so
The-
that's the response always when the health department data is so late?
Yes,
You get a letter
that
like
is
that.
that is the message that I have been sending out. The other message that I've been sending out is if it's, of course, if it's a vaccinated person, they are made aware that they have been exposed. Please continue to monitor for symptoms and consider, and it is recommended that you wear a mask indoors when you're with people who are not of your immediate family for 14 days, and I give them an end date. So I do send that one out.
Do we have any consideration for antibody testing, natural immunity, and how that plays a role in close contacts?
At this point, there's nothing that I'm aware of.
Okay, so natural immunity would not be in consideration for close contacts, just
Yes.
the immunization?
No, if they test positive and they are exposed within the next 90 days, they do not have to quarantine unless they are symptomatic.
Yes.
If they become symptomatic, then they automatically, and this goes for the people who are vaccinated.
Yes.
If they become symptomatic, then they need to stay home, and then they go into the systematic, or the people who have symptoms, they go into that realm, just like anybody else who has symptoms. They go into, you stay home. If you are close contact, and the way the close contact works, if you are a close contact and you are asymptomatic, you have 2 options, and I give the parents both options. The first option is they're home for 10 days, and if they are asymptomatic, they are able to return to school on day 11, but we ask them to monitor for symptoms for the remainder of the 14 days. If they choose to test out, as long as they remain without symptoms, they can have their child tested on day 6 or 7. If they are negative, they are able to return to school on day 8, but we ask that they monitor for symptoms for the remainder of the 14 days. So we give the parents that option. I will tell you, we do not have a lot of parents taking that option, but that option is clearly given them when I do my close contacting. When I'm doing my contact tracing, everything I do this year is the same as I did last year, except with the addition of the option of testing on day 6 or 7 to come back on day 8. Everything else is the same as it was last year.
What about, we've gotten a lot of questions and feedback about students that have symptoms not close contact. So the students that have an upset belly from not
Okay.
eating breakfast, or the student with seasonal allergies. So what is our protocol for those that not related to contact with a COVID case, but just simply, I was
Okay.
outside this week and I have a runny nose today. What does that look like for students?
All right, first off, I do want to let you know, I cannot differentiate the difference between COVID symptom or allergies, or someone who has an upset stomach because they ate too much candy or ate something wrong the night before, okay? I can't, that's out of my realm of practice. So what we do is we screen them. Depending on the amount of symptoms that they report to us, that directs us into the direction that we need to go. If they have one low-risk symptom, they have a runny nose, they have congestion, their stomach hurts, they're nauseated, they have one low-risk symptom, that child is sent home, and they can come back to school without any testing and without quarantining once they are symptom-free for 24 hours. And if they're nauseated, diarrhea, things like that, that's what we've always done. We've always said they have to stay home for 24 hours, symptom-free, before they can come back.
Yeah, I'm just,
They don't need to be tested.
no, but what about kids with allergies? I mean, it's allergy season.
Again,
that kind
they have an option, and I tell this to all the parents with kids with allergies. If your child has allergies, talk to your primary physician. If we get that physician if they send us a note that specifically states, please do not exclude this child from school based on nasal congestion, runny nose, cough. If we've got that written down, we don't exclude them. But we cannot at this point, because allergy symptoms mimic, bless you, allergy symptoms mimic COVID. They're similar, and we can't differentiate. I would not want anybody else in the school district to try to determine if that is allergies or if it's COVID. So if it's one low-risk symptom, they can come back after they're symptom-free for 24 hours. They do not need to quarantine. If they have 2 low-risk symptoms or 1 high-risk symptom, and the sheet that Angie had showed you has them clearly identified on there. If they have 1 high-risk or 2 low-risk, that is when we do say, yes, you need to go home, and you're home for 10 days, or you can seek testing. If your child is negative, they are able to return back to school once their symptoms have improved, and they are fever-free for 24 hours without the use of medication. So parents are given the options of what they choose. When it comes to the symptoms, yes, we do say they have to go home, but they have the option of keeping them home for 10 days, or they do have the option of having them tested, which, if they're negative, they can come back once their symptoms have improved. I don't expect them at that point with a negative test to have to wait until they're completely gone.
Darlene, when is our testing clinic going to be available, and who's going to be able to get tested there?
Okay, our testing clinic, I just have to work out a few logistics. I have to get the website up and running. People, anybody that is connected to the district, if you've got a grandchild here and you're sick, the grandparents can come in and get tested here. This is basically, they've made it so basically anybody in the community is able to get tested. If it's a neighbor who comes and picks the child up after school, that neighbor is able to seek testing, as is the neighbor's children. So they've made it so almost everybody can get tested. I just need to pull up the website. They are going to require parents to register their people, and anybody register online. If it's an older person who doesn't have any computer skills, and there are some that really struggle with that, we will have the paperwork readily available. They will just need to schedule an appointment to come in and have it done. They'll have to fill out the paperwork first. So I just have to get a few logistics up and running. Plus, I'm also looking at having school-aged children, having a parent sign another consent, saying that, yes, there will be a box that they will click on the computer saying they give consent, but I would like them to actually sign a secondary consent saying that, yes, they do still request that we do the swab.
And will they sign that right when they're getting the
Yes.
test?
They'll sign it before they get the test. And we will have the ability to do the rapid tests. In fact, I have probably well over 100 of the rapid tests already in my office. And I also have the PCR tests. The rapid tests I will be able to resolve myself because those take about 20 minutes to half an hour to resolve, to get the results. That is the one that will be used for the asymptomatic close contacts. The PCR test will be the one that has to be sent out. If I know I'm going to be swabbing and doing a PCR test, I just need to call the courier. They will come to the school, they will pick up the sample the same day, and they will transport it to Wauwatosa. Once it reaches Wauwatosa and the lab, the turnaround time is 24 hours. And then as long as they've registered online, the lab will import all of the information online. They will notify the person of the results, and all that information will be sent to DHS. So there won't be anything for me to do except for make sure I can go in, and I have to link the sample with a barcode, and then the lab does everything else, and they notify the people.
But you don't get the result then? You don't know until you're notified by the student or the person who gets tested or the
Yes,
parent?
I do not get the results. It goes right, as far as I know, at this point, I do not get the results. It goes right to the person or the parent of the person getting swabbed.
And you said you only have 100 swabs of the rapid and?
Oh, I have over 100 of the rapid. They come in 40 kits in a box.
Oh, okay.
And they just sent me some more boxes of the
Okay.
rapid, so I have quite
So
a bit.
you'd be able to do this, the 3 to 5 day testing that we are talking about
For the
post-exposure?
asymptomatic. Mhm. Yes, and then the PCR will be the diagnostic for symptoms.
Okay, any other questions for Darlene?
Do you, when we voted for our motion on the contract tracing that Angie read us earlier, I was under the impression that it was seemed like the same thing we were doing last year. Did you feel that that motion is consistent with our memorandum of understanding, Julie? Or do you-
Absolutely, or I would not have signed the memorandum. We clarified after Jill made the motion, we had discussion about specifically Darlene assisting, but not creating the protocol, and reference that it would be the same as last year.
Okay, does that sound reasonable to the rest of you?
But it is true, and, you know, I'll try again tomorrow. I had a discussion with Angel Zimmerman earlier today, but it is true that our public doesn't clearly understand that. You know, the messenger gets the brunt of frustration, and I think there are people who believe that as a district, we're just deciding to do this on our own. And so we'll do a better job of making sure or helping people understand that, you know, again, those governing bodies with their guidelines, that's what we are following.
Would it be helpful maybe on your COVID site there on the school website to put in something like a FAQ so that people, instead of answering everybody, you know, people can read up there, you can let them know what the responsibilities of a school nurse are when it comes to a public health issue, that you are bound to respect the requests and accede to the requests of the public health authorities, at least during public health crisis or pandemics, that you don't have a choice, you cannot say no to them. So that is why we are in this position of having to do the contact tracing or respond back to them when they ask. You cannot plead ignorance or say that, you know, that's not in my purview.
Okay. And we'll also schedule a meeting with the health department to discuss some of the options that I heard from board members tonight and how they might impact quarantining.
I'd definitely like to pursue that option of the masking as a criteria.
Okay.
So one more question, Julie. Is it true that our district has letterhead paper from the county that we send information out on? From the district, not the county, and that Jean Weston's name is on there when she's resigned?
When we signed that memorandum, Jean was still employed here. And
Sure.
so, yep, she signed that. And at that time, that letter template went out. She was still employed as well.
So we do have that letter template in
Right,
our...
and it's because we're following their guidelines. That is an agreement that they said, yep, go ahead and use their letterhead.
So presumably we need to take her off now.
Yes. Dar, did we remove her name from letters that go out? Jean
The
Weston?
name hasn't been removed yet, but I will certainly contact them to have them remove the name. They do not have another health officer at this point to replace her. Jean had left on the 17th, I believe, was her last day, September 17th, so it was just recently. And the reason that we do use the letterhead is because Public Health wrote the note and sent it to us to use. So that is the reason it's on letterhead.
I'm just going to share final thoughts. As a board member, I'm also a parent with school-age children, and I'll tell you that this conversation, this discussion has actually been very confusing overall and overwhelming. I feel like there's a lot of hurdles for children to go to school. There's a lot of testing, there's a lot of wait, there's a lot of quarantine, there's a lot of allergies, but you got to get a doctor's note, but then, you know, or you got to get tested or stay home. Like, there's so much that it's. My feedback is just simply this. I'm not making anything specific in this. It's very overwhelming, and I would love to get to a point where we can identify an end game, because the Delta variant is this year. That's probably why our numbers are higher, in addition to not having masks. I guess, so my point is this. It's overwhelming. How do we keep kids in school? How do we reduce all the if this, then that, guidelines? And what's our end game? Because COVID's not going to go away. So, you know, if we could identify that, not in this discussion, it's going to be a much further discussion, but this is overwhelming.
Yeah, COVID will subside. and get better. This has been the course of the pandemic. Unfortunately, we're in this wave right now, but March, April, May, June were really quite good. And we had 0 cases in the county for 2 weeks in July, and we'll be back to that. This is a really stressful time.
Yes,
And
and
until I hear that.
respectfully, Dr. McKenna, you shared that same feedback, and so I think, and I know that you don't control a pandemic, I'm not saying that. Sometimes it feels like it will get better is not really attainable. And again, that's not a
Yeah.
personal statement to you because you don't have
Absolutely.
control of it. It's just,
Yeah.
at what point do we say, okay, this is our normal? COVID will be around, there will be variants, and
Yeah.
how do we have a streamlined process to move forward?
Absolutely. Right now, we're in a state of healthcare crisis. So that's not this moment, but certainly in the coming months, things will get better because it does reach a natural equilibrium. And we've seen that with other pandemics we've faced. Actually, this is following the pattern of past pandemics as well over time. But it is definitely a challenging time. And I appreciate the board's efforts with processing complex information that is continuously changing. I know we do have a lot of different moving parts, and H.L. Mencken said, for every complex problem, there's an answer that is clear, simple, and wrong, ultimately. So we just have to do our best, and answers can be complex, and we'll keep working to make this better over time. So, thank you.
Julie, I do like Dr. Deep's suggestion on the website, on the COVID dashboard for the Q&A, or FAQ, so that way some of those questions that the community may have can be addressed and asked and answered in that atmosphere. Because the community is looking at that dashboard, which is great for us.
Or at least link right to the statute and paste the text in there and say it's not up to us, so then they'll get the emails.
Agree, yeah.
The question I have is, will we run foul of public health authorities if we decide to mask the kids and keep them in school if they are exposed to somebody and they continue to mask? Do we have to get their permission before we make that decision? Or can we as a board?
Dr.
decide?
Deep, I'm sorry, I didn't hear what you just said.
Do we have to wait for the input from public health, or can we make the decision to mask kids and keep them in school without quarantining if they continue to mask?
My belief is we'd have to get public health's endorsement.
And I think you're thinking the sooner we move ahead with something, the
Right, what
better
I'm
off
saying
we'd
is our
be.
next meeting is in 2 weeks or 3 weeks. You're not going to make a decision until then, while every day you're hearing of kids getting quarantined. So between now and then, you might probably have a third of the kids stay home. That's 2 weeks.
Right? We could try to schedule the meeting as soon as possible and call a special board meeting if we have updated information to share.
And also, Dr. Sprague, certainly it would be up to the board to authorize, medical advising and the administration to, to move forward with, plans based upon that collaboration and discussion. Though I would say that would likely involve a mask.
I'd like to make a motion. If it fails, it fails.
Dr. Deep, we're not going to do a motion that wasn't posted on the agenda.
But this says, and possible action.
We made a verbal agreement last meeting to put motions on, but it does still say possible action. That was our attempt, if anything would come up from discussion, but last meeting we agreed to post motions as such, a verbal agreement.
I feel like I missed.
And we will.
Yeah, I think we're going to Dr. McKenna can go ahead and meet with the county health department, and if they're willing to do anything, then I'm saying we'll call a special meeting.
Right, because do you think they'll have a different opinion on Dr. Deep's original idea is very palatable?
But
If the person-
will this not add to the weight of our discussions with them, that the board is in favor of something like this?
Do you think they'd feel differently? Your original idea was if a student voluntarily wears a mask, they can stay home. That might get a lot, I mean, they can stay in school. That might get a lot more kids that want to wear a mask. I don't know what percentages are right now. Versus if we say everybody's got to wear a mask, then the county really might come along and say, okay, we'll do that in that case.
But then it also opens up the situation where it's an honor system then. Who's going to figure out who's wearing, who's not wearing? You're putting additional responsibilities on your teachers, your other staff, your school nurse.
So you much prefer the voluntary, which it's not.
No, I'd say if everybody wears it indoors, and then they don't have to quarantine if they are exposed to somebody who's tested positive.
Dr. Deep, I think right now it is on the honor system for the close contacts anyway, so I don't think that would change, if I heard you correctly.
What I'm saying is that supposing we are all the students in
Yep.
a classroom and we are all masked, and if one of us is positive, the rest of us, even though we have spent the whole day or 2 days or today's Tuesday, Monday, Tuesday, we have been together, none of us have to be quarantined, okay? We will continue to come back to school, we'll continue to mask as long as we are asymptomatic. That keeps us all in school except for the one student who tested positive and will probably have to stay home if they're symptomatic. That's the only person who will be out. The rest of us will be in school. Nobody misses school. And it's not a stress on the parents.
Yep, sorry, I thought I heard you say the honor system if like
No,
JD
what I'm
said,
saying
yeah.
is if you just suggest to kids to wear it, they may or may not, and then after the fact, when you say, so-and-so in this class tested positive, everybody in class says, well, I wore a mask, so I'm going to stay in school. So that's what I'm getting at.
We'd have to take mask attendance, that'd be.
I think realistically, if we wanted to deal with the health department, I think what you're suggesting, Dr. Deep, they may consider. I just don't picture that they're going to consider this thing where, yes, students can or cannot wear masks. I mean, I think I would like to see a compromise here, but I think we have to be realistic about what that compromise might be.
My compromise is I want to see the kids in school, not being quarantined like this when you have classes upon classes being quarantined, kids not getting their education. Our responsibility is their physical health, their mental health, their education.
Yeah,
See,
I'm
an
in
hour and a
agreement
half,
with what
all
you
we do
proposed.
every meeting is we just talked about this. We are not going anywhere. Meeting after meeting, we talk about COVID. How much time are we spending talking about other issues? How much time have we spent talking about their achievements, their scores, or what they are doing? Go back and look at the meetings. We need to put an end to this. We need to get our kids back in school and make sure that they get that education and their emotional health doesn't suffer, and save those parents. We are a blue-collar community. People struggle. And then on top of that, they have to go home, they have to teach their kids. And then you're talking about kids not getting their homework assignments. I live close to town. I live in a oasis where I don't get internet. I have to go to my office to sit and use my internet. There are people out there with that situation. It's a disservice to our kids.
Dr. Bardo, did you have something?
Yeah, you guys all know I'm anti-mask, but I brought one tonight because I wasn't really feeling good today, and I thought I might have one of my coughing fits, and I didn't want to have a coughing fit, have Dr. Deep get sprayed or something. But I am anti-mask. But if we can make what he's talking about happen, because my position has always been, I'm to the point where quarantine the kid and the rest who are traced, I want them in school. Always have wanted them in school. Because we talk student achievement. We want it to be higher. And if they're home, they aren't improving and their scores are going to go down. So, as much as I'm anti-mask, in this situation, if the local health department says we have a group of 30 kids in a fourth grade classroom and we're mask optional like we are now, and one kid gets COVID, we don't quarantine the whole class, which is what we do now. I would be willing at that point going forward to say parents have a choice. If they choose to put a mask on their child so that the child can be in school during that time period, okay. If the parent chooses to keep that traced kid home, they made that decision. If we're a high school kid and there are 6 kids that contact traced with him, and I think this is what Dr. Deep was getting at, those 6 parents have a choice for that child. They can put a mask on them the next day. We know they were contact traced. We better see them in school with a mask. If the parent doesn't want to put the mask on the kid, then they go through the protocol that we've been doing for a year and 2 months. They stay at home until they meet those criterion to come back. But the parents and the child made the choice not to wear the mask, and so they stay at home and are quarantined. If I understand what Dr. Deep is saying, have I said it correctly?
I'd like to keep them, probably they should be encouraged to
Oh,
mask
Dr.
at all
Deep,
times.
forward.
They should probably be encouraged to mask at all times, at least for the next couple months.
Well, I'm not willing to
I
go
know,
there.
I know
However,
not.
but to keep kids in class,
That
if
is
the
what I'm
parent,
saying.
if the parent chooses to send their kid who has contact trace with a mask, they can come back the next day.
So
So I will be okay with that.
I'm pretty sure I understand what both of you have said, and
Yep.
Dr. Sprague, have you understood it, and you
I
can
have.
convey this to public health?
Because it just comes down to, I want those kids in school. I don't want them at home, and our parents don't want them at home.
I
And
think
it
we
will
can
be
all
better
agree on that.
educationally if they're here in our 5 buildings.
Yeah.
Okay, so I think we can agree on that, and I think we're at the point where we really have to have Dr. Sprague and Dr. McKenna talk to public health. They have these 2 options here that you have both presented a different option, and I think those are good options for them to consider and a good starting point. So
I think Crandon has something similar to what Dr. Bardo just shared. I think Crandon has something in their current policy. I'm sharing that.
Brandon?
They just had to go virtual, though, because they had such a spike, but yes.
But
the health
the
department.
spike was not specific to COVID. The spike was
Yeah.
RSV and
Hand, foot,
hand,
mouth.
foot, mouth. So I think I'm just sharing though,
But yes,
that
I-
the encouragement of other
I have a
districts and health
copy of
departments
their-
working together. Yeah.
I'm pretty sure that Crandon is also going to mandatory masking for a month.
Could
That's
be.
what they had on the news this morning. So, but.
I'll take their plan when we have our meeting and see if parts of it we can make work.
Sure.
Okay,
And then we may have a special meeting to bring back that information if it's before our
Correct.
committee of the whole meeting. Correct.
are we done with COVID?
I am.
God, yes.
Okay, we're going to move on from COVID
Okay.
and go to new business. And item A is approve the committee of the whole minutes from September 14th.
I move the board approve the committee of the whole minutes from September 14th, 2021.
Second.
Any questions or comments? All those in favor?
Aye.
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 Any opposed? And we'll go on to item B, is a policy manual review, the 5,000 students. And does anybody have any comments on on any of the 5,000s?
There's a lot.
There's a lot of reading there.
There sure is.
And I'm just going to say that, there was a couple things I read that I sent a question to Mary Kay, and she responded, and I think that's fully appropriate if you're reading through stuff and you want to send her a question and it just gets answered.
That was my feedback too. I sent some questions and you followed up.
Okay. Wasn't sure you got it in time.
Yep, thank you.
And then we'll go on to item C, third Friday enrollment report. And Tim?
So board members, in your packet, there's a sheet that I've used in years, kind of tracking where we're going with FTE after third Friday. And I just want to give you a little snapshot. So if we start over on the right-hand side of the page, and I want to give credit to Stephanie Parker and Mary Kay for putting this together for me. So we have essentially comparing last year's third Friday count to this year's third Friday count. And then at the budget hearing, I had projections. And so the long and the short of it is, and again, now this was from last week, so it's a week after third Friday. Stephanie Parker and Mary Kay are still certifying that third Friday count, so this is truly preliminary information. But we had, if you can see there, we had 2,176 students that were enrolled in the district on third Friday count. And that was an uptick of 49 students. So from my perspective, I'm looking at FTE in the revenue limit formula. And at the budget hearing, I was projecting that we were going to lose 25 FTE in the enrollment and the revenue limit formula. And what happens with that is we get a one-time exemption, which means we get more money when we lose more students to prepare for future smaller revenue limits. So I look at it from that perspective, and the net effect of the increased enrollment is my estimate based on the information I had from last week is that we're going to drop 240,000 in the revenue limit formula. So what that means is essentially the estimate right now is the local levy is likely to go down. And that number is going to tweak a little bit in between now and when we finalize our third Friday enrollment, but it's likely to be down over $200,000. Then on the left-hand side of the page is information Mary Kay provides. And that's basically just giving you a breakdown of the ins and outs of open enrollment, where those students are going to and coming from, and comparing last year to this year's information. And again, that's only 1 week after third Friday. Mary Kay and Stephanie are still certifying that count this week. So then if we slide down to the, again, on the right-hand side and go down to the bottom, you can see the impact of open enrollment. So I'm comparing the budget report in what I have in the budget as of the budget hearing to the preliminary third Friday count. And you can see that we have fewer students open enrolling out and more students coming in that I had projected. And the net impact is that we would have an additional $246,000. So the net effect is our revenues will be consistent, the levy will be less, we'll get a little more state aid and a little less tuition deduction for the open enrolled out than I had projected. But again, this is just third Friday, and that open enrollment happens, the DPI is monitoring that every day, and we get assessed either the positive or negative based on daily attendance. So questions other than that, At the committee of the whole, I'll have this updated, and I'll have tighter numbers for the revenue limit and where we're going with the budget.
Tim, so if I'm looking at this correctly, we're basically going to send out about 1,020,000.
Yeah,
That's what we're going to send to other districts to educate our kids.
parents have chosen that, yep.
Yeah. Okay. Now I want to talk about the 246. Are you saying, first of all, just so I heard it correctly, were you saying that you're expecting, because we actually have more kids, a positive 49, which will, whatever the revenue limit is, for example, it might be 8,100. So it's 49 times 8,100 of plus money, correct?
So, Dr. Bardo, there's a 3-year rolling average.
Right, I understand that.
Yeah, so I'm looking at the difference in the FTE and plugging it into I've got like a revenue limit template. And since the revenue limit is made up of state aid and local levy,
Yep.
I'm just suggesting that based on the numbers, 3-year rolling average right now, it looks between, I say 240, let's call it 200,000, is what.
So you saying we're going to actually get $200,000 less
Correct,
than last year?
correct.
Okay. So the fact that,
It's.
I know, I understand it's an estimate.
No, it's not, it's the limit. So the size of the pie, it doesn't say anything about aid. It's just the size of the pie is going to be 200,000, 240,000 less than what I had estimated in the budget.
Okay, so basically then what you're saying is what we've saved in your budget projection, which is the bottom right, sitting at 246,000 plus dollars, that basically is evened out by what's going to happen to our revenue limit based on what your projections are at this point.
Correct.
Because originally, when I was thinking that, here's $246,000, I was going to say, let's put it in Fund 46 and get some air exchangers in the middle school and our 3 elementaries. But now you're telling me that that's not the case.
Correct.
Okay. The other day you told me that we added $200,000 to the fund balance.
Yes.
How much money did we put into Fund 46 and 73? Approximate. I know that you'd have to look it up, and I apologize.
I think between the two of them, Dave, I don't want to, I don't have that off the top of my head right now.
200,000?
It was more than that.
That's what I thought.
Yep.
500? Maybe?
I think it was 270, it was over 500.
Okay. 500 plus thousand that we added there, and we took.
And again, though, I think the reason for if you remember, we had over projected for the OPEB liability is how we ended up with the money.
Right, I understand that. So we moved 500 plus thousand out of Fund 10 into those accounts, which was a
Correct.
good move, okay? But here's my question. We put 900,000 in fund balance last year, correct? Approximate.
The year prior, yeah. Mhm.
Yep. And so this year we moved 500,000 into 46 and 73, plus we're adding 200,000 more to the fund balance. So last year, we didn't spend $900,000 of our tax money that came in, whether it be local, federal, state. This year, we didn't spend $700,000. And so, I'm thinking of our 10-year plan that Jake gave us that talked about new lights in our elementaries, our high school, was it LED lights? We didn't do that, did we?
No.
Did we do any paving, like up here at the high school this year, that this is probably the worst driveway for kids to come in ever? No. And we certainly haven't done air exchangers in our middle school and our 3 elementaries who probably need them.
I think we have air exchangers in the 3 elementaries.
Yeah, we did that all when we upgraded them.
They were $700,000 apiece.
Well, that was the
Without air
heating and
conditioning.
air. Did that include the sufficient air exchangers to help with
COVID?
mitigate this COVID now?
So my point, so whether we did air exchangers or not, my problem, and I think the board needs to really think about this, we're taxing our people to the max, which we really need to do under the revenue limit, because that tells us what to tax for. But yet, what it also tells me is over the last 2 years, we haven't used 1.6 million of the dollars. So we need to be talking to Jake, we need to be talking to Tim, and the people out there who work for us, where can we spend our money? Because if we're not doing it each year, and we talk about our kids not doing well, especially in our lower grades, why aren't we hiring more teachers to decrease the amount of kids in a class, or hiring more aides to come in to give specific help to kids who need it? So my point is, we need to be better stewards of the money we tax for.
Dr. Bardo, if I could just make one comment.
Sure.
The part last year, we received over $800,000 in federal stimulus money. And I told the board repeatedly that I was taking and using that money in replacement of Fund $10. So there's a reason why that fund balance was built by $200,000. Your point is very well taken. We don't need money sitting in the bank. It should be put to use.
And it needs to be put to make our facilities and for the betterment of our kids. And we need to spend the money we tax for those kids. And I'm done.
Julie,
JD, I also want to point out that on that 10-year plan, I'm looking at it now, in all 3 of our elementary schools, it does have attic insulation and ventilation. I don't know what that includes, but it is on all 3 of the schools that is in there. I don't know if that's the air exchange, because I know you're right, we have spent $750,000 on each one of those schools over the last, 3 years, 4 years, Andy? And in renewing, updating the heating and air conditioning in those 3 elementary schools, which is what needed to be done.
will you have Jake email us on that? I just thought, it was like 2 years ago when this first happened that Jake said he was going to max up the air exchange to the maximum, but it was going to cost us $50,000 more in our electric bill or something. But we thought that was money well spent. But you just have him double check that.
Yes.
But I don't remember that.
And the heating bill.
I don't remember that the elementaries can do the max. I think the only building is the air exchange is this one, right? I'm trying to remember, Andy, you've got a great memory too, where he told us about the air exchange that's just above us right here.
I think those elementaries do have
Okay.
increased air exchange capacity, and it's actually this building that
It's
the
not.
air exchange is not so great because of the way it was set up originally.
And the middle school, obviously, is not.
And that is probably correct.
So my
We'll check.
So just a question, just for us to think about going forward. When there is a surplus in our fund on July the 30th, Tim, is that whenever we zero the counts? On July the 30th? So if there is a surplus like there was this year of $200,000, can we set a policy to where with surplus funds for it not to go, because we can't move it now because we're past July 30th. So we're going to be probably in trouble for state and federal aid again because we're putting $200,000 in the fund balance. But going forward, can we set a policy to where we have surplus that can automatically go into Fund 46 in order to fund the 10-year building program, because that's always, as Tim well knows, because he was the building and ground supervisor, that's never going to go away, because there's always going to be maintenance on our buildings. So is there something, a way that we can, where we don't have to have Tim to bring it to us and say, hey, we have an excess, I need a motion to put this into Fund 46? Can we just automatically do this going forward? I don't know, just a question.
You know, and Danny, just a point of clarification. So the adjustment was an OPEB liability where we have this OPEB trust.
Right.
And it was as part of the audit. The auditors said that we had, you know, I sent you a memo on net present value of the trust, and we simply used the wrong number. I used the wrong number, and the consultant that we paid to help us figure this out didn't understand the implication. So it was after June or July 30th, because the audit happened that end of July and August.
Right.
So it was after the deadline at which I could do anything about it. It had to go into fund balance. We can move money at any point in the year into the Fund 46 trust, and we have until July 30th to make that authorization. So I think the closer we get to that date, so if I would bring it to the committee in July,
Right.
that's a great time to decide where to go with it. And then Jake has the remainder of the time to decide how he's going to use those funds.
Right. I mean, I also see the importance of Dr. Bartle. If we're seeing that we've had all this money left over to the end of the year, why don't we look at Julie and say, is there something we can do for more aides? I know we could probably use more support staff across the district. Some of the teachers can use some more aides in their classrooms. We hear Mary all the time, because she has contact with the teachers, talking about the shortage of that support staff. I think there's areas that we can utilize this for student achievement, and that's what we're after, is student achievement, rather than just putting it away and tucking it away into Fund 10. When our Fund 10 balance is at that mark that they want us to be at that 10% mark. So it's not important for us to put money in at this point. It's more important for student achievement, which, in my opinion, that's more important at any time.
Yep.
Tim,
Does that all make sense?
yes. But Tim, aren't we pulling money right back out of Fund 46 this year?
Yes,
So we put it in, we're taking it right back out.
right?
Yeah.
Yeah, but if we put it in Fund 10 at the end of the year, not Fund 46, we get in trouble for it, right?
You mean because we don't get a state tax credit?
Yes.
Correct.
So that's, put it in Fund 46 is where it should be, though we are going to pull it right back out because we have a laundry list of projects that need to be done.
Yes.
But we just need to zero the balance on July the 30th, according to what I've learned at the finance meetings that I've gone to and learned from Tim. And if he knows going before July the 30th, if he has $100,000 left over, he doesn't have to come to us, because we've set a policy that if there is a surplus, he can automatically move that into Fund 46.
He could do that, but I don't, in my opinion, it doesn't hurt for him to come before the board and get that approved.
I also want to caution the board too, you're talking about, I know 200,000 sounds like a big number, but 200,000 on 30 million or 35 million is, when you're the person responsible for making sure you don't get into the red, that's not a very big number. And the advantage, yes, of going into Fund 46 is we grab aids on it right away. And it also allows Jake a better opportunity to vet projects and prioritize what needs to be done with the money that's available. From the business manager's perspective, I don't have to short-term borrow this year because we have a reasonable fund balance. If you look at Anago's fund balance compared to the state average, we are not sitting in a position that many districts would like to be in. I think I had mentioned at the hearing that we're somewhere between 14 and 15% of prior year expenditures. Our accountants are recommending 25% for cash flow purposes and because we're a district of declining enrollment. And once the federal monies go away, it's going to get tighter and tighter. So I'm not an advocate to fund it down to nothing. I think we want to be prudent with it. We want to make sure we're capturing aides. I'm confident that we're doing, this past year, we finished as good as anybody could expect that we could do. And I'm very sensitive to the levy. I know what it means because I get the calls. So I understand, Dr. Bardo, and I'm right along there with you in agreement.
Okay. Unless there's more comments on that third Friday enrollment, we'll go on to item D, public access to agenda items. And this came up at the community engagement meeting we had last week. And I know that we've brought this up twice before, but last week people were saying, should we give the public access to our attachments that are in board docs essentially as soon as we get them? Or I think the other option, which Mary Kay is not crazy about, is that she could give them those attachments, say, on Monday afternoon, or even Tuesday afternoon, to the public.
Yeah, I'd have to transfer everything from one line item to a different line item is what it would be.
And we're not talking about any attachments that would be in closed session or really any, it would only be attachments that are, that people could get anyhow if they just make a public records request. And so this is, when we hold a meeting in the middle school IMC, you know, we put stuff up on the board, or we should put stuff up on the board. I think we all agree that. But really, if you're sitting in the back of the room, you're sitting at a 90-degree angle to the board. It's kind of hard to read. In my experience, when I'm not on the board and I'm at a board meeting, if you don't have the attachments, you know, it's hard to follow along what the board's talking about, especially when we're all looking at the attachment on our computer and talking. Anybody in the public, it's hard to follow along. So I guess what I might be looking for here is consensus to put those things on, make those things available to the public. And I guess the question would be, make them available at the same time we get them, or make them available on Tuesday afternoon, or if anybody's opposed to making them available, then we could bring this back as an action item and vote on it.
As I've thought about it, you know, we want the people to be able to see the attachments because then they can really see what's happening. And if we open them up on the Friday when we get them, it's our responsibility to take a look. And if we get questions and we haven't looked, they'll know we haven't looked. So at this point, I'm for just letting them see it, and it's our responsibility as the board, when we get those on Friday, take a look, because you might get a phone call. And I have no problem with our people seeing, for example, what Tim presented us with, so that they can actually see, you know, the numbers, how many kids are going to Elko, how many are coming in from Elko, that kind of stuff. Sure. It's okay for them to see that.
Andy, I know I've been looking around at other school districts' COVID-related information, and I was surprised, pleasantly surprised to see how all the school districts that I've looked into make that public for everybody to see, even prior to. And I would say the same time Mary Kay sends it out to everybody else, let it be open, because then that's less for her to have to remember, oh, I got to do this on Tuesday. So, and plus, that's another layer of transparency. I wasn't at the engagement meeting, but I'm in favor of this.
I'm just going to say it's not just something for Mary Kay to remember. It's kind of clunky to do it.
Yeah, I'm sure it is.
That was going to be my feedback too. I know in this discussion we had before, that was one of the things is the work you would have to put into that Mary Kay. And I guess for me, when I think about this, I keep trying to think what would be the benefit to it being released at separate times, like to the board first, community second. And I don't know that I'm coming up with a real significant benefit to that. I will say that the agenda coming out on Fridays, my personal opinion is it's a very limited time to thoroughly review the agenda and follow up. Dr. Sprague, you know I'm routinely a late Monday night with questions or Tuesday, not because I didn't open it until then, but because by the time I reviewed, processed, and thought about it, then I formulate my questions. So for those reasons, I feel like it makes sense to have the attachments available to the public at the same time it is available to us.
Andy, if I might just, from someone that is typically submitting information or presenting to the board, I know that if as we speak in front of people, you want to have the most absolutely accurate information you can process. And with the business cycle, we often get, Mary Kay knows that I'm almost always the last contributor to getting the board packet out. And in my rush to get that to Mary Kay, I often, like Jill, will look at it on Friday afternoon late after I've given it to her. I'll look at it on Saturday and then finally on Monday morning. And I'll often say, well, Mary Kay, I made a mistake. I have some kind of grammatical error. There might be an addition error. There might be something. So I'm having her to pull that information and then re-upload it. And for me, I know that my information would be more accurate if I had till Monday. You know, when I first started with the district, we mailed the packets to the board members on Friday afternoon, and they got a packet, and they didn't go out until the Friday's mail. So, and I know that that's old school and that's never going to happen again, but by moving it up, it does stress the office. And if I could have just a little more time, I'd appreciate it.
Well, could you just write on there, on the front page where it says the meeting time, the document may be changed prior to the meeting, you know, so if you really have a question, check it.
I think it's on there, 24 hours, anything could change on the agenda. And that would be part of the attachment.
No,
Oh,
Right?
so you can change the agenda within 24 hours, but there's nothing that says if Tim wants to add a document at
Absolutely.
5 o'clock on Tuesday afternoon, he can do that. And
Absolutely.
JD's saying that there should just be somewhere on the agenda that says documents may be added or
removed
changed.
or
Watch for
changed.
updates.
Yeah, just, I mean, it probably doesn't even need to say that, and it can still happen, but that way people won't be surprised if you say, hey, we screwed up, let's fix it.
Yeah. So is
I
there?
don't know, and I'd even say just for YouTube, maybe at the beginning of the meeting, we should say, hey, you're watching online, and you can click on this if you go to boarddocs.com and click on public, or we should paste it somewhere more obvious. Is it on our YouTube page, the link to Board Docs somehow?
Oh, I don't.
On the
I don't think
website,
they'll-
I don't know. if it's
And the
on.
YouTube link?
Yeah, just
I don't
some-
think it's attached to that, but that's a good idea.
I don't know how, but somehow it seems possible.
Okay, thank you.
Oh.
Okay, so just, I just want to know if we have consensus
Okay,
on
so
going,
Tina, go on the agenda then, the website for Board Docs?
if we have consensus on this, or is anybody opposed to it?
No. I do have one more question. I'm okay with it, it's great, but can Dustin, can Dustin put the attachments the night of the meetings? So for example, Tim's presentation just a moment ago, could that be shown the night of the meeting? So that way people at home that are watching, they see the attachment there. They're not fumbling with two devices to look at an attachment and plus look at the meeting.
That came up at our
I'm not very
community
technical
engagement
savvy, so that,
piece. Jill shared that idea, and It's written on my desk, Dustin, I just haven't taken the time to ask you about that yet.
Otherwise, the easy solution would be to open up one web browser with the YouTube clip and another web browser with Border Doc and make them each take up half your window, and you can look at both of them.
I'm trying to think of somebody who's not very tech savvy.
This is like
that would
2
make
clicks.
it easy.
This is-
Okay, we've put a lot on our community with remote learning, all have, so I agree. Any shortcuts we can provide to people is great.
And I got through it.
So Julie will talk to Dustin about that.
He'll make a YouTube video explaining how to do that, then they can follow the steps.
Dustin didn't know he was going to get working orders.
Yeah. Okay, so we'll just go ahead with that then. Okay, so we're going to move along to
Thank God.
board action. Item A, consideration to approve a revised food service wage schedule.
I move the board approve the revised nutritional service wage schedule as presented.
Second.
And we went over this in the COW meeting, and has anybody got any further questions or comments? Then a roll call.
Maddox Nelson,
Yes.
Newfeld,
Yes.
Hyatt,
Yes.
Schrader,
Yes.
Bardo,
Yes.
Deep,
Yes.
Gagnon,
Yes.
Mary,
Yes. And item B is consideration to approve the 2021-2022 NTC dual credit agreement.
I move the board approve the 2021-2022 NTC dual credit agreement as presented.
Second that.
Any,
seconded, I'm sorry.
Give it to Jill.
Okay, thank you.
any questions or comments on this? We'll go ahead and do a roll call.
Newfeld,
Yes.
Hyatt,
Yes.
Schrader,
Yes.
Bardo,
Yes.
Deep,
Yes.
Gagnon,
Yes.
Maddox Nelson,
Yes.
and Mary.
Yes. And item C is consideration to approve the spring 2022 Start College Now students.
I move the board approve the Start College Now participants for spring 2022.
Second.
Any questions or comments? All those in favor?
Aye.
Aye.
Any opposed? We'll go on to item D, consideration to approve the second reading of policy 7250, commemoration of school facilities.
I move the board approve the second reading of policy 7250, commemoration of school facilities as presented.
I'll second that.
Any questions or comments on this? Then all those in favor?
Aye.
Any opposed? And we'll go on to item E, consideration to approve Art Club overnight trip.
I move the board approve the Art Club overnight trip to Madison and Milwaukee on November 11 and 12, 2021.
Second.
Can I add something on there? I'm sorry, it didn't come through on board docs. The girls' tennis team had also made a request for an overnight trip for a possible sectional competition in, I believe it's River Falls, next week. So
I'll
they'd
add
like
that.
that included.
I'll add that to my motion.
And I'll second that added.
Okay? Any questions or comments on those two trips? Then all those in favor?
Aye.
Any opposed? And we'll go on to a report of donations.
I move the board accept the following donations: $680 from NRAC for NRPAC for Fill a Backpack, Fill a Need program, $1,000 from Phyllis Maddock Memorial for Noboken School Forest Project, $140.25 from Zodis for Anigo FFA, and $10,000 from Stephen Memorial Home for a 1908 Steinway 6-foot grand piano for the Anigo High School Music Department for a total of $11,820.25.
I'll second that and say that my son loves that piano.
Is 1908 a model number, or is it like?
No, I
No,
think that's the year.
That's the year of the piano. It's really nice looking.
Okay. So we'd just like to say thank you to all those who have donated,
Yep.
and all those in favor?
Aye.
Any opposed?
Nay.
And a motion to adjourn.
So moved.
Second?
And all those in favor?
Aye.
Thank you.